Thank you. So, and then the presentations there are so good. So I'm looking at the room. I guess I'm the only task leader from Work Package 8. So I will try to cover briefly two main tasks, considering the functional profiling, which really connects to what Hinak was saying, and then the conformity assessment scheme work. Those of you who were there for the morning session already heard some of the related things, and of course here also we must build very heavily on what's already there. So both in terms of what's there in systems, what's there for cross-border infrastructure, what's there for the EF network guidelines and specifications, existing standards, but also conformity assessment practices and testing platforms that are there and should be used. But there are also some new elements with the HDS, regulatory compliance, the database of EHR systems, mandatory application on national level in addition to the European level requirements, etc. So part of the beginning of the work, there is a glossary by XTHR project, which hasn't been mentioned yet in this session, I think. But there we have collected many of the things that we are using. These are some of the key terms for Work Package 8. So what do we actually mean by conformance, compliance, functional profiles, and things like that? So you can actually find the definitions there, because using a common language, since there are so big networks we are all working with, it's very important to have basic concepts as well. So glossary is one thing that actually supports that. But to go to more detail in some of the tasks that we have. So the certification and labeling framework, the Work Package 8, has three main topics. One of them is the classification of functional profiles. One of them deals with the conformity assessment scheme. And one of them deals more with wellness apps in EHDS. So about the two first ones, we do have some material here. You may have seen this if you were there in this morning. So there have been lots of questions by industry representatives who are building the HR systems. So from the viewpoint of my system or a user organization, from the viewpoint of the systems that I use as a whole or of a certain module, how do I respond to the requirements of EHDS? And there are easy ones and there are hard ones, and the hard ones are especially interesting, of course. And we know that in reality, Marcello was talking about the reality check, so the systems landscape is really a reality check as well. In one hospital, you may have very many different vendors, very many different modules. This is a real-world example, simplified, but real-world example of one of the hospitals that has many things, many different kinds of systems, some of which are more relevant for the goals of the HDS than others. So not everything is at the same line, starting with the systems. Of course, we can do many different kinds of classifications of different types of systems. So traditional electronic medical record management, departmental specialized systems, financial things. Well, is that anymore within the scope of the clinical goals that we have and the rights of the citizens that are enforced by EHDS? So this is part of the discussion. That's where we do need some guidelines. Of course, the project is doing basis for the implementing acts by the Commission. And part of that is that we need to tie the regulatory level to the specification level that Hinak and Esther and others were mentioning in previous presentations. So part of that is that we need entry points for systems. So the internet purpose of a system, for what purpose, what is the data, what are the functions that I have in my system. That's really an entry point to many of the EHDS requirements. And using that on a high level, we can define models and guidelines for different types of EHR systems. That, okay, if you are using a lab, if you are a laboratory, you should have these kinds of capabilities. Coming back to what Hinek was talking about, the roles, about the obligations, etc. And of course, it comes down to the detailed requirements, detailed specifications, considering both the logical model and the detailed implementation guides of standards, which must be used. But for one system, you may have requirements from different kinds of categories of requirements, security requirements, some requirements related to patient summary. Not even all patient summary sections are always used by all systems. Some for prescribing, etc. So if it's a large system, you may have very many different kinds of relevant parts in HDS you need to consider. But if you are a small system for very specialized thing, not so much. So giving guidance on these things is part of the work. And that you have the declaration of conformity, where you actually need to tie things together on high level and also on detailed level for implementation, on design of how do I implement the harmonized components in detailed conformity assessment. So functional profiles have been used in some countries already, in many projects already, but never on European level before this. So for regulation, they can be used to define a certain level of requirements for different types of certain types of systems, so that one system might fulfill several different profiles. Manufacturers are using them as a guideline. Health service providers may see, okay, I need these types of systems in my operations. So what do I find in the database of the systems? And supervisory authorities will use them in assessing whether they are compliant or not. So that's part of the work package 8 work. There are, of course, work related to assertions for conformity assessment, and we don't have task leaders here, but I'll tell briefly a few key points about this. So, of course, the goal is to provide a conformity assessment framework, which is very well suited with the detailed obligations that Hinek was proposing, which has a set of testable assertions that can be actually tested, and of course the means of verification for the self-assessment that is there for the HDS. And it should be pragmatic, readiness-based approach, of course, starting from the purpose of each system. It has two parts. So there is a governance model. This has been actually worked between work packages 4 and 8 in XTHR. And of course, the content part as well, where you actually have the testable assertions. For governance, there must be the progressive adoption. So we know that the requirements are going to change, and there are going to be new versions of specifications, as well as incremental level of requirements for different types of systems over time. And of course, governance also has the assessment procedures and goals for equitability and things like that. And then, of course, we need the content, which should make use of what we already have on different kinds of conformity assessment models. There are many, and many good ones then to draw this work from, both for interoperability and logging components that are there for the EHDS. So some of the key points include the ability to evolve and increase the maturity. Change management is, of course, very important because it's a complex set of different kinds of things, considering both legal and specification implementation level, but also the introduction and the deployment of the systems. Okay, so I hope this gives you an idea of some of the key things in Work Package 8, and there will be more detailed sessions on those parts that were not covered here, but thank you.